Sickle cell disease is an inherited condition and it presents with multiple complications, particularly pain, and also affects long-term survival. So that babies who are diagnosed with sickle cell disease need to be diagnosed early to be able to prevent complications. So for example, a baby born with sickle cell disease in East London, for example, would survive, 99% of them will survive into adulthood. But in Africa, it is actually reported that less than 2% will survive beyond the age of 5 years. But this can actually be improved and prevented if there is early diagnosis and also there is intervention that actually helps to prevent early death due to infections and other complications. So as a member of the American Society of Haematology and also the British Society of Haematology, I'm involved in a joint initiative between the two societies to try and develop capacity for newborn screening, which involves laboratory diagnosis and standard, but also to make sure that those diagnoses actually lead to treatment and make sure that treatment is given very early on, and also education as well as other support. The education is actually multifaceted, both to doctors, nurses, and also other professionals. Because in Africa, for example, the healthcare provision is heavily supported by community health extension workers. So we want to make sure that these people actually are kind of advised and understand what the treatment involves, to how to identify babies with complications, but also how to initiate very early onset treatment like penicillin prophylaxis, and also provide parents with information as to what they can do, like drinking of water, and also some prophylactic measures such as vaccinations. And the use of penicillin is something that has been very low in Africa, but also malaria. Malaria for sickle cell patients is a major problem. Even though people think that the carriers are protected, but the sickle cell patients are not protected. The initiative will have a kind of a bilateral or multilateral benefit, because for those who are in the United Kingdom or other developed countries, they receive treatment, but we need to understand the basis on why some of them don't adhere with treatment, because we really need to understand their cultural perspectives. In Africa, there have been lots of myths, particularly for the fact that the patient is born, and then they die within a short period of time. And a number of the African cultures think that this is a child that keeps dying and coming back, not realizing that they can do something to prevent the child dying. And also the fact that families don't want to be associated with sickle cell disease, because if they have a child with sickle cell disease, the society think that they are a weak family, and that can lead to issues in terms of marriages and also acceptability within the community. One of the things we can do is to work with the Africans to actually develop models that will help kind of enlighten families about what the treatment involved, and the fact that this condition is inherited. It's not kind of imposed as a result of any witchcraft or any other issues that can be major challenges. But we can benefit by understanding what is it that actually guides their own beliefs. I'm a member of the special interest group for global hematology, and we're working to make sure that we can encourage people from here to actually go to Africa, and Africans to come here. So I led an application with the European grant, which is the Horizon 2020, and we have a grant that allows us to undertake staff exchanges in terms of research and training in sickle cell disease, particularly in newborn screening. And this involves Kenya, Nigeria, and in fact, even the Middle East, Lebanon. People can come from Lebanon, from Nigeria and Kenya into the UK or other European countries, which include Greece, Cyprus, and France. They can come and receive training and go back and implement those kind of changes. But also young doctors or senior doctors or nurses and hematology specialists can actually go out to spend between a month to 12 months and to do some research and actually help build capacity in this area. So we think that this program would offer opportunity for the development of skills, but also individual career development from people who are coming from here. And so we're actually going to offer an opportunity for members of British Society of Haematology to actually volunteer themselves to actually either go or to receive people from there. But they can work on a joint project. So we will provide that information on the website. There are multiple benefits, and some of these benefits include institutional partnerships. So As a result of this project, you can have partnership between your institution and another institution, but also that offers opportunity to send young and aspiring faculty to go and train, and that also lead to personal skills development, but also in terms of career development, because somebody developing a career in global health would actually be an opportunity to actually begin to showcase their work across the world. But also we're thinking that because Europe has the skills, Europe needs to show that they can undertake this task at a level that other people can follow example. So there are multiple reasons, but individual, institutional, and also systemic benefits that this opportunity offers. So this is actually under the Marie Curie grant. Marie Curie is staff and research capacity development. So we are going to provide, there's a website which is going to be scorecharity.com, but I'll provide that website. But also we'll have a program manager that actually will provide the emails through the BSH so that they can make contacts with that person so that they can show their interest. But also we have the Royal College of Pathology, which is part of that project, that actually are sending out advertisement to members on a quarterly basis so that they can be aware of this program. But they can contact me as well.